Hi everybody, this is Dr. Blevins with Enilda Clinic at enildaclinic.com. Go ahead and hit subscribe and like this video. We're going to talk about anxiety and ADHD today, the difference between them and how they often become confused. So oftentimes I hear from parents after they've gone to the pediatrician with their child and they're concerned because their child is forgetting things, they miss directions, they can't organize their work, and they're fidgety, they can't seem to sit still in their desk, things like that. And so they tell the doctor all of these different concerns and they sound exactly like ADHD. And so what I've seen, every single pediatrician I know of does the same thing. Now there's different types, but they do the same thing. They bring out a rating scale and it has maybe like 10 to 20, 25 questions on it, and they're all about ADHD. If you've ever looked up the name at the top of those rating scales, they're always a very specific rating scale for ADHD. We call that a narrow band scale. So it's measuring symptoms of ADHD. Well, if you go in and you're stating out symptoms of ADHD, and then you take a rating scale that's saying, hey, do you have symptoms of ADHD? Yeah, it's going to elevate. Of course, it's going to elevate. And so your child's pediatrician is probably going to say, yeah, it looks like ADHD. I do not argue with that. Of course, it looks like ADHD if you give an ADHD rating scale. So what happens after that? How do people end up coming to me? Well, sometimes the kid might end up on a stimulant medicine. So if the child has anxiety, then sometimes stimulant medicines will actually increase the anxiety a good bit. Instead of calming the child down, if the child had true ADHD, it'll just amp them up more. So I'll hear parents say they just blew up, like the behaviors became so much worse. And so if you're noticing those kinds of thoughts running through your head after you started medication for ADHD, then maybe, definitely talk to your doctor, your child's pediatrician, and maybe start to think, okay, is there a more complex presentation here for my kid? So let's talk about what anxiety looks like. There are different types of anxiety. Rather than going into different diagnoses, I want to talk about the features of anxiety. So there are two different levels here. One level is the physiological symptoms. So that is the person's heart is racing, the person has different chemicals, different hormones really racing through their body, and that's making them fidget. So they're moving around. They might even be getting up out of their chair and kind of pacing around. They can't sit still. Their minds might be racing, thinking about all these upcoming events that they're nervous about. They might not be able to keep their train of thought on this one topic that you need them to think about, or their teacher needs them to think about, because they're so anxious about something else that's coming up. And all kids do this, like Christmas, right? We're coming up on Christmas 2020. I'm betting every kid this last week of school was a little bit focused on the Christmas party or the holiday party that they were going to have for school, instead of focusing maybe on those last little academic tests that were going to get done. Does that make a kid anxious, or does that make a kid ADHD? Absolutely not. But if a kid is doing that type of behavior all the time, and it leads them to not be able to get their work done, not be able to listen to directions, not be able to get their chores done, not be able to interact with their peers and maintain friendships, then we're starting to see some impairment going on. So what are some other signs of anxiety? Memory. So if you give your kid a list and they can repeat it back to you, they understand what to do, but later on they have already forgotten, then that's a sign of anxiety. And again, this is all about where's the child's attention. The child might be able to focus on you while you're talking, but really in the back of their head, they're still thinking about that topic that gives them anxiety. So let me think if there was anything else. We've covered memory, we've covered fidgeting, we've covered getting tasks done. It's really, really hard to get tasks done if you're constantly being distracted by your own mind. And so in a very real way, ADHD and anxiety look almost exactly alike. Whenever you're trying to complete work, it takes longer because in your mind, you're thinking about the thing that makes you anxious, and that is distracting you. Okay, so I think now I've covered it all. So yeah, whenever you're stating symptoms to your child's pediatrician, it's important to have a broadband measure. That's something that looks at lots of different types of reasons why your child might be having different symptoms. It would include something like anxiety. It might include things like depression, autism, all these kinds of things. It's not to say that your child or even your pediatrician has concerns that your child might have those things, but what it does do is it allows for the, potentially catching a greater number of reasons that would account for those symptoms. And so if we had a broadband that looked at anxiety and ADHD with all those other things, and both of those elevated, then what we could do is we could explore it further and understand, okay, is the anxiety this child experiences actually looking like ADHD and it's really just anxiety and really just a small course of behavior treatment, some strategies that we can help the parent develop to then do with the child, all those kinds of things. Is that going to be sufficient and really help this kid? And then they'll be all on their merry way and feeling better. Or might there actually be a little bit of ADHD going on in addition to, or totally just ADHD and not anxiety at all? And so that increased exploration can take a little bit more time and involve a little bit more assessment and interview. Typically, your child's pediatrician isn't going to do that. Not that I've seen. I mean, I don't want to have such a generalized statement to say all pediatricians aren't going to do that. And even some pediatricians might give broadbands. So some of you out there might get this experience whenever you go to your child's pediatrician. But what I have seen is that in general, you have to go to a psychologist and get a neuropsychological evaluation, which will have a broadband, and then investigate those scales that are elevating so that they are explored and match with the concerns you come in with, right? Whatever data we collect in an evaluation should really start to explain those concerns that you come in with as a parent, the distress the child is experiencing and telling you about as the parent. And then it should all align to create a treatment plan that really addresses the underlying cause. And as you can imagine, if it is anxiety, the treatment plan is dramatically different than if the underlying cause is ADHD. Something I should have said earlier, ADHD, there's two different types. So there's the inattentive presentation, and then there's the hyperactive impulsive presentation. So whenever I say ADHD, I'm talking about both presentations. Of course, there's a third presentation, which is combined. So somebody has numerous symptoms from both different types. Squirrel and Blue, my cats, man. So whenever I talk about ADHD, I'm meaning both different types, right? And so if you think, oh no, my kid doesn't have ADHD, they have ADD, I'm talking about you guys too. Okay, all right. I hope this video was helpful. And if you are having difficulty kind of finding the right approach, and that very first thing that came to mind was ADHD for your kid, treatment's not working, especially if you guys have a history of anxiety in your family, it might be something that's worth exploring with your child's pediatrician a bit more, maybe getting a referral to a behavioral health specialist and seeing if it helps. All right, you can go to enildaclinic.com to find more videos, and make sure you subscribe and like this video at youtube.com. All right, I'll see you guys later. Bye.